Today on Keynote.
And so it really is, how do we clean up our environment? How do we create resilience? How do we build a partnership where instead of making your life harder, we're actually giving you tools that reduce the burden of InfoSec on top of your already busy day?
I'm Drex DeFord, a recovering healthcare CIO and longtime cyber advisor for some of the world's most innovative cybersecurity companies. Now I'm president of Cyber and Risk at This Week Health and the 229 Project, where we are dedicated to transforming healthcare one connection at a time. Our keynote show is designed to share conference-level value with you every week. Now, let's get started with today's episode. Hey, welcome everyone. I'm really glad you're here. This is the webinar that you've been looking for. We're talking about the Zero Trust Hospital, revolutionizing healthcare security in the digital age. And we'll get into how to embrace the zero trust concepts, ultimately how that will help secure the future of patient care. Today's webinar is sponsored by the good folks at Zscaler. I'm Drex DeFord. I'm your host today, the cyber and risk guy at This Week Health. And if you would, please hang in there with me. We're going to give folks a couple of minutes to show up late because that's the world that we live in today. Folks will be a little bit late. The last meeting ran over. We'll want to give everybody a couple of minutes. So we'll get underway with the webinar shortly. For those who've already joined us, thanks for being here. Thanks for submitting questions for the webinar. We've been looking at those. For those of you who put questions in when you registered, we've got a lot of them. And as a reminder, you can submit additional questions during the webinar through the webinar sidebar. There's a Q&A block for that, and I have that up and running, and Holly's going to keep me squared away on that. I have Winn from AdventHealth here and Tamer Baker from Zscaler here, and I'll ask you guys to do a quick intro, but in a couple of minutes. So while we're waiting for folks to join, here's a goofy little question. Ryan, what was your first computer? You've been doing this for a while. What was your very first computer?
My first computer, I don't even know if you could qualify it as a computer. It was a Timex Sinclair T1000, I think is what it was. I bought it for $48, mostly in rolled quarters, as I recall. And yeah, it was one of those things that had only volatile memory. You couldn't save anything unless you bought a tape deck, which I couldn't afford at the time. So if I wrote a program, I just had to leave it on.
I love that. Tamer, I know we've talked about this before. You didn't buy your first computer, right? You built it.
That's right. Yeah. So the first computer I built, because we couldn't afford to buy a computer for a long time. And I had a friend of the family that was more well off, and he saw my inclination to IT and he offered to buy me a computer. And I said, no, just get these parts for me. And it was a 386 SX 33 megahertz with I think it was a 9600 baud modem.
Yeah.
DBS systems, Prodigy. It was a MS-DOS system at the time. And then I remember how revolutionary it was when I installed Windows 3.0. It was just a fun time as a child, right? Building all that stuff.
So amazing.
Yeah.
So amazing.
Back then, too, it was really fun to upgrade, right? Like you buy an extra one little meg RAM stick and like, yes, this is great.
This thing screams now.
Yeah.
When you had little ports where you could actually plug things in and make your computer better. I was a Commodore 64 guy. Yeah, I had a little black and white TV that it plugged into. And like you, Ryan, anything that I did on it, it had to stay on all the time. I think I wound up getting some sort of a cassette player or something that I could save off to the cassette so I could reload stuff later. But yeah, what a terrible way to start. And look at us now. Look at where we are now.
Those are fun times.
Those are good times. Okay, it's a few minutes past the top of the hour. Again, thanks to everyone for joining. I really appreciate it. Let me take a look down here.
We got our first Q&A question in.
Oh, the K-Pro. People answering the question too. The K-Pro. Yeah. That's a classic too. You can tell when people answer this question, there's a little bit about being able to figure out their age by the answer to this question too, especially if you're a bunch of nerds like us. Okay, as I said earlier, this is the Zero Trust Hospital, revolutionizing healthcare security for the digital age, a webinar sponsored by Zscaler. Again, I'm Drex DeFord, a longtime recovering healthcare CIO. Now I'm the cybersecurity and risk leader of This Week Health and the 229 Project, and I'll be your moderator today. In the virtual room with me here are a couple of my friends and a pair of folks who can really get into the practical parts of how to do zero trust It's Ryan from AdventHealth and Tamer from Zscaler. Gentlemen, thanks for being here with us.
Thank you for having us.
Yeah, thanks for having us.
Again, to the audience, thanks for being here. Thanks for submitting questions when you registered. And of course, thanks to Zscaler and our panelists. And a quick thanks to Holly too, because Holly, our producer, actually is the one who keeps us on the straight and narrow. So let's start with some introductions. Brian, why don't you go first? Tell us a little bit about your background, and then we'll flip over to Tamer.
Sure, sounds good. Yeah, my name's Ryan Winn. I'm the Chief Information Security Officer for AdventHealth. Some of you may know us, some of you maybe not. We're a fairly large healthcare system based out of Orlando, Florida. We're in 9 states, 50 plus hospitals. We're growing pretty fast. And we just crested 100,000 users. And really excited about the growth and trajectory, and glad to be here and be able to talk with you guys today.
Appreciate it. Tamer, what's going on, buddy?
Yeah. So for those of you that don't know me yet, I'm Tamer Baker. I'm the healthcare CTO at Zscaler. So all of the healthcare audience business, I'm the CTO for. I've been at Zscaler for a few years now, ever since we started the vertical for healthcare. And for those of you, again, that don't realize, we're not just a verticalized healthcare in the sense of we've got an account team that does healthcare. It's everything from myself, from the product side, building in all the and providing integrations, medical device security, et cetera, all the way down to our architects, our customer success managers, and everything. Like, we have a full portfolio of healthcare specific folks here to support the team. So happy to be here. Happy to have this conversation with both of you.
Yeah, thanks. I'm really glad you're both here too. I've enjoyed all the prep time and the prep conversations with this too. So here's another thing. By the way, there is a book associated with this webinar. I was lucky enough, I think at HIMSS, you gave me a copy of the book, and Tamer actually signed it because Tamer is the author of the book. You can download this book, Zero Trust Hospital, the CXO Vision. Tamer Baker and I, of course, I should mention your co-author, David Anderson. You can download the book. We'll make sure we put a link in the comments, but just in case, you can go to thisweekhealth.com/zerotrust and then scroll down. There's a link down there that says download the book now. It's in bright red. So go do that right now so you can get a copy of the book. This is just one book in a series of books about zero trust, right? Tamer, tell me a little bit about the others.
So it's a 2-book series right now. The second book is the Architect's Guide. And that was primarily authored by our principal engineer, Stephen Hadgeny. So between the 2 books, my CXO Vision book was tailored more towards this. It's not Zscaler specific. It's really understanding the business value of zero trust and the operational efficiencies and financial gains, how you foster a zero trust environment with the other leaders in your organization, et cetera. So it's all way more on the business value side for a CXO. The Architect's Guide is the detailed, like, how do you actually do it? And example policies, examples of how you deploy this. So it's very detailed. So if you're on the webinar and you're a CXO, I would still grab both books because you can get your Architect's Guide out to your teams as well. And if you are an architect or a director or something that's not CXO level, grab both books and hand it up to your CXO if that's of interest. So I highly recommend both books in the series.
This webinar actually is like the punchline of a whole series of podcasts that Tamer and I did around zero trust. So if you haven't seen those, we'll also send you a link to those podcasts so that you can read the book and follow along in the podcast, because we track the chapters to the podcast too. Okay, here we go. You guys ready?
Yeah.
Let's do it.
I'm going to start. Obviously, I'll start with Ryan. Can you give me kind of the 50,000 foot view of what you've done with zero trust at AdventHealth? Your approach has been a little bit different. Tell me how you started. Give me the high level story.
I think I'm probably in a similar position to many of you on the call. I came into this role about 1.5 years ago and made a lot of changes to update and put better technologies in place so that our security team had a decent chance of trying to secure our organization and be successful. So we basically ripped and replaced every piece of protective technology that we had out there, the backend and support systems, ticketing, privacy systems, all of those sorts of things. So we went soup to nuts and built a completely new architecture for security. And in the process, what we wanted to keep in mind was taking a zero trust lens and applying the framework principles. As we purchased, we made selections, and we started to move forward. Obviously, one of the partners that we selected to work with was Zscaler. So we went live. We actually had a really fast project. We started in I don't know, Tamer, was that July? I think it was July of last year, and we were fully displaced the previous technologies by October 12th. I think was our go live date for Zscaler. So 4 months in an organization our size. So we were rapid pace there. So we started with the proxy side of it. And what we're doing right now is we're actually moving into the ZPA space, which Tamer will talk about the technical details of that later. But ultimately, what we're really trying to do is solve some business problems with it. So there's absolutely security benefits. But what we're trying to prove is that there's also cost and benefits from just simplifying the way that your network works. And what we're trying to do is create models, and we're really looking at the ambulatory space a lot as well to see if we can create a lower cost go to market, speed to market for our ambulatory services, because those are areas that are under significant financial pressure. So we're looking to start standing up zero trust clinics here very shortly. And ZPA is a basis of that branch connector, et cetera. And then a lot of this other infrastructure that we put in place. So that's where our heads are going. And I know everybody comes at this from a little bit different angle, but again, we all have different business problems, but it's a business problem solution that we're trying to implement.
It's interesting to me that you rope into this the idea that there's tech debt, there's other challenges in the organization. You used the Zscaler project and the Zero Trust program to help simplify the environment. Simpler is easier to operate and run, and it's obviously easier to secure too. How did you get everybody on board with that?
It's an ongoing process. So we're in the early stages of what we're doing. And when people talk about a zero trust journey, I think it's just that. And it's one that doesn't really end. I don't think you ever get to a point where you feel like, hey, I've nailed it. I am totally zero trust. We're good. What we're really trying to do is build a level of flexibility into the infrastructure that we put in place. Because again, I assume many of you suffer the same challenges. A lot of different things are thrown at you in a given year. A lot of different acquisitions, different business trends, different cyber threats that are coming down the road as well. And so what we need to do, and it gets back to that simplicity point, is if you can't move quickly, you can't take advantage of opportunities. And so what we're hoping to do is our model continues to progress. Speed to market is one of the key factors, and you can't move fast unless you have something that's repeatable. Repeatable tends to be simple, and simple is easier to secure than complex for sure.
I would say it's almost split 50-50 as far as who's a business owner of something like this. About half of our health systems, the business owner is the CISO, and then the other half is a CTO, because the CISOs want the security, et cetera, that this provides, and the CTOs want that simplicity and new way of doing things. One of my favorite quotes that I actually put in the book, and I'm going to paraphrase it because I don't remember exactly how it was quoted by the CIO. It was the CIO of a large, very well-known brand, and he said, "We can't keep innovating by trying to put new technologies, new applications, new innovations into 20-year-old architectures, right? It doesn't work well today. So when you do this simplification, it allows you to innovate faster. If it's a new physician that wants a new thing, new application, new Da Vinci robot, whatever it may be, or it's a business innovation, new acquisition, whatever it may be, being able to have a simpler architecture, which is also secured, but allows you to do this innovation faster. And that's one of the business values that we actually talk about in the CXO vision.
Yeah, I love that. So for you, Tamer, what opportunities do emerging technologies like AI, opportunities and maybe challenges that new tech like AI present when you're trying to integrate and field a zero trust framework?
I guess we can't have a webinar without talking about AI. You can't have anything anymore without talking about AI. There's so many different forms of AI. So this can go in many different directions, of course. AI is one of those innovations that everybody wants, right? Everybody needs it. If you're not using it some way, shape, or form, or multiple different ways, right? For the clinician side, for the admin side, et cetera, you're going to get left behind, right? You have to get on that train. The challenge becomes, how do you do it securely? Because many organizations haven't even stood up. How do we govern it? What are the governance processes? So a lot of people have put just blocks into place, and it's stifling that innovation. With something like this in place, though, this structure, this way of doing a quote unquote zero trust, like what Ryan was talking about, it allows you to implement these new innovations in AI but doing it securely so that, okay, allow the users to talk to the AIs that you want them to talk to, which you don't even have visibility on all the dozens of AIs that exist. We'll give you that visibility, show you which ones users are trying to use. And then instead of just putting a block on there, just because we can see all the prompts and we're decrypting all the traffic, we can see exactly what goes into the AI. You can just block sensitive data going in there, PHI, either sensitive information about the health system, et cetera. Just don't let that go through to it. Or the other flip side of it is maybe you're building an LLM, maybe you're building some models for whether it's research or diagnostics or whatever it may be. We want to make sure that stuff isn't getting poisoned. We want to make sure only the right users are accessing it, make sure that bad actors can't get to it if they have compromised your system. Those are the challenges, like how do I do this securely and how do I do it to where I can't lose data and I can't compromise patient care by a poisoned LLM, but also enabling that business to do it.
Yeah, I'm going to follow up here. Another question that I see, practical advice that you would offer CXOs who are hesitant to embrace the zero trust process due to perceived barriers. And you have a great chapter in here about kind of myth busting, all the stuff that goes into this, but hit a couple of highlights there. They're pretty interesting.
I'll talk two quick barriers that I've seen commonly. One is the perceived notion of disruption, because people have tried to do zero trust in the past at the network layer, whether that's ACLs, firewall rules, DACLs, micro-segmentation with other things. There's so many different ways people have attempted to do it at the network layer, and it's very disruptive. Lots of failed projects I've seen in the past that just gave zero trust that negative connotation, right? It became a four-letter word in a lot of organizations and outside those organizations. But in reality, once you see the modern way of trying to do it, and you're not doing it at the network layer, and you're not trying to deal with IPs and firewall rules, et cetera, it becomes a lot simpler, as Ryan has talked about, and it becomes possible to do this a lot easier. Another perceived barrier is cost. And typically that's operational headaches, operational costs, operational burdens on top of what it would cost to put in a whole bunch of boxes, et cetera. That's another myth that we talk about and bust, because what you find, and Ryan also touched on this a little bit, is when we're simplifying architectures, you're also removing costs. You're also taking out legacy tech debt. You're also lowering the cost to manage and maintain this, because operationally now you're able to do this with fewer human capital hours because it's a lot simpler way to do it. So those are some of the barriers, and you can have these discussions across different teams in your organization to just alleviate that burden. What you'll find is if you talk to our customers that have gone through this journey, the care providers actually are happier because we've made it easier for them to do their work with less burden. The security is in the background. They don't even realize they're getting zero trust access to things because it's a lot faster for them and a lot less clicks, as an example. So it's a much easier process for those care providers, and they don't even know it's zero trust because you don't talk about it in those terms. Right. We talk about it, well, we're going to do a transformation or modernization or whatever that helps alleviate that burden as well.
Yeah, I love where the story's going here. Simplification, creating agility for the business to be able to do the things that the business wants to do and needs to do quickly so that they're not hindered by the legacy stuff and the legacy way of doing things, I guess, that a lot of organizations are mired in. Ryan, how do healthcare organizations measure success and progress in their zero trust journey? You talked about it being a journey. What are the measurement tools, the measurement things that you're looking at to see that you're making progress?
To Tamer's point, when we're talking about zero trust, we know that it's an embedded concept in what we're trying to do, but I almost never talk about zero trust.
How do you brand it? How are you branding it?
Well, so what we've talked about is how do you decrease the blast radius when something bad happens? This is in the technical areas. Outside of technology, we talk about it a little bit differently, but it's really how do you create more resilience for your organization? Because resilience is key, particularly in healthcare. You know, we see this time and time again being more and more of a focus. So how do you create resilience by having redundancies and simplification and easier ways to do things than we've done historically? The other sort of like internal branding is what we're really trying to do is, for years as a CISO, and I've been on both sides of the fence. I've been a CIO, I've been a CISO, and I've delved on the technology side as well. You know what information security would typically do is they'd make your life harder. They'd say, hey, network team, this is all the stuff that you need to do in order to make us secure. And as the tools have improved, as the approach has changed, as you look at things like Zscaler and Zero Trust and those sorts of things, you get to go back and say, hey, I'm going to actually make this easier for you. And a lot of those protections that we relied on in the past, you can take out some of those things. So we talk about network simplification that has absolutely nothing to do with a zero trust architecture necessarily. And so it really is, how do we clean up our environment? How do we create resilience? How do we build a partnership where instead of making your life harder, we're actually giving you tools that reduce the burden of InfoSec on top of your already busy day.
Yeah, it makes it so that your InfoSec or IT teams are no longer a quote unquote cost center and a black hole. It's you guys are helping to enable innovation, right? You're enabling those that are outside of IT to be able to be innovative and do what they want to do. Pretty sure I quoted this in the book. There was another CISO in Florida, not you, Ryan. I didn't quote you in the book this time, but he said that this gives me the opportunity, this being this model, this architecture, it gives me the opportunity to default on my technical debt. Like for once, I can't keep trying to innovate on top of my current technologies and just do another update and another upgrade to the latest version of that. I can default on all that debt and just start fresh, right? That was powerful to me. I told him, as soon as he told me that line, I was like, I'm going to reuse this over and over again. Like defaulting on your tech debt was a fantastic way to put it.
Ryan, what's your vision for the role of zero trust shaping the future of patient care? You talked on it there, or maybe it was Tamer mentioned it very briefly. Physicians, they don't know why they like it, but they know it feels good, right? What's the future tied to patient care and obviously operational efficiencies in general on the clinical side?
Yeah, I think it's a little bit of a cascading effect. So when you're able to do things easier and faster for providers and they don't have to think about it, it lets them pay more attention to patient care. So I seriously doubt there's ever going to be a time that a physician comes to me and says, hey, I really appreciate this zero trust stuff. That'll never happen. That's not going to be a conversation that we have. But what we can see is when we reduce the number of times they're exposed to making decisions that could either cause them problems or help them out, when we make it, I think we talked about this earlier, when you make it hard to do the wrong thing and easy to do the right thing, it makes their days easier. So I think ultimately the technology should be fairly transparent. It should be providing a layer of security without an extra layer of operational burden. And as a result, it gives providers the time to refocus in the work that they really want to be doing, which is interacting and taking care of the communities that we serve.
I'm going to be contrary to one statement that you made, which was nobody will ever tell you thank you for this is better, because I've had two different CTOs at two different orgs tell me this. One of them said that their chief radiologist, and they were just deploying this to a couple of the radiologists, including the chief and one or two others as a test. That chief radiologist told them, like, how do I get this out to the rest of my radiologists? Because this is so much better. It's the best thing you've ever put in my environment. Like, I need this everywhere. And then the other CTO told me that their chief also came up to him and actually in the hallway gave him a hug and said, thank you. You've made our life so much faster and better. So that has happened. At least I've heard two different stories of it where you do get a thank you from some of the squeakiest wheels, which are those remote imaging folks out there. So yeah.
If I get a hug, I'll text the group and I will affirm your assertions there.
I want a photo of the hug in
That's right.
progress, like a selfie that we can post. A good problem to have, right? When you have folks coming to you and starting to demand that you hurry up and get it to them because we're not going to have great place to work scores this year if you guys don't get that tech to us.
It's not like he was happy that they were more secure.
No.
He was happy because they were getting more reads in per day.
Life is
per
easier.
week.
Yeah.
Like that was exciting for them. Instead of clicking on the image and then going and making a sandwich, eating lunch and all this other stuff and then coming back to it, they were able to get a lot more reads in. So that's what made them happy. And again, they had no idea they were getting zero trust access and it was way more secure.
Yeah. And just a reminder to the folks in the audience, if you want to submit questions, you absolutely can. There's Q&A in the sidebar. Let me hit a couple of those. These kind of could be maybe merged into the same question. The question, I'll start with you, Tamer, go to Ryan. How much difficulty is involved in handling the medical device space versus hospital users versus hospital guests? And the other question is in the same vein, how do you handle zero trust on IoT and medical devices? that typically don't have things like user logging or don't support loading a client. That whole group of kind of medical device stuff. How do you guys handle that?
Yeah, I think that's a great question. It's done a little differently in the sense that we're not doing medical devices to apps, right? It's usually device, et cetera. The way you handle it, and I mentioned this earlier, if you're trying to do zero trust at the network layer with ACLs, VLANs, firewall rules, becomes exceedingly difficult. We've changed that paradigm even at that level.
The problem there often is that because the only way to do this is through the legacy way we've always done it,
Yep.
that it's so burdensome that we take shortcuts and create risk that we didn't intend to create, but just, dude, there's only so many hours in the day. And
Yeah.
so,
Yeah. The difference now is, again, going back to the simplification and doing things easier, is instead of trying to create rules that way, we're able to control their traffic flows by saying, hey, it's human readable language on a screen. These types of devices are communicating to these things, and do you want to create a rule for this? You're not looking at IPs, you're not looking at VLANs. It doesn't matter. Any of that stuff doesn't matter now. You're easily seeing how things are flowing, and then you can isolate them. So you're creating bubble wraps around them, but in a human readable way. So now they're protected. And then additional protections are a lot of these devices today now are reaching out to the internet, right? They have to get their updates from GE or whoever that you're using. So we're monitoring the communications as well externally and making sure that, hey, if this device starts talking to command and control, we need to do something about it. So, A, block that command and control so that the bad actors can't use it as a pivot point to move laterally, and then also alert the team that something's going on there. There's a couple of ways that we handle those devices, and we do it again in a simpler, easier to read way to do it.
Ryan, give us some of the practical real world. What are you guys thinking about medical devices and things that have traditionally been like both of you have been doing this for 30 plus years. It's always been a very painful thing to try to figure out.
If anybody thinks they're doing a fantastic job, I'll up your pay if you come work for me. Yeah, it's one of those areas that I think we've struggled with for quite a while. So I would say what the Zscaler implementation, particularly the data fabric associated with Zscaler, has been able to help us do is I feel like we have a much better understanding of all of the things that are on our network. Our inventory systems, inventory spread between a bunch of different things, the logging platforms that we're using. When we started using this, we were able to see what users were interacting with what devices and where they sat on the network to a certain extent in a way that we never had done so before. And we have the fingerprinting services and stuff to, kind of define the devices. What it really has allowed us to do is understand how big the breadbasket is a little bit better and then start developing the strategy. So I think with all of these kinds of problems, the first issue that you've got to solve is, do you know how big your problem is? And do you know where things are? And if you can answer that, then you can come up with a strategy to move forward. The other thing, just from a very simplistic perspective, is if you do, it kind of depending on where you start from a zero trust perspective, one of the things you can do is get your users off the network. If your users are off the network where all of your biomed and IoT devices are, it makes those a lot less likely to be impacted by attacks and that sort of thing. So segmentation works on a couple of different levels there, but I don't think we're really in a place to, pontificate on our particular segmentation strategy at this point. But I think we're getting really close to having a great plan because of a lot of, the data that we've been able to aggregate.
So one of the things we talked about prior to the webinar and the prep was using zero trust for you to be able to not only see the things that are on your network, but the apps that are on your network and how that has changed the way you've thought about driving prioritization and risk management and all of that. Tell me a little bit about that story, Ryan.
Very much the same way that we were looking for an accurate asset inventory for the things that are on our network. We were able to use telemetry from a variety of different systems to see all of the different applications that were being used. And it was a significantly higher count than we knew. I don't know that it was 10x, but it certainly was at least 4x what we knowingly had in our databases, but we were looking at through various versions and all of those sorts of things. And again, going back to the data fabric piece of this, we were pulling in our vulnerability system as well. So we could actually do a little bit better triage of what we needed to work on. Because again, to your point, Drex, knowing what you have maybe it's not half the battle, but it's probably a quarter of the battle. And then you can decide based on the counts. And if you feel like you've got accurate data at that point, you can focus your remediation efforts on the vulnerabilities that are going to give you the greatest level of protection. So again, I think it's the same play as the assets. It's you've got to have the inventory, and then you can attack your vulnerabilities a lot more effectively. And then as you see that, one of the reasons for doing this is eventually you want to be able to understand what your users are actually using. So you've got users, you've got assets, you have applications, and then the data that sits behind the applications in a lot of cases. So if you really understand that, you can do better identity management and understanding what typical use looks like. And I think there's a play ultimately for this where we can take a look at one of our ambulatory clinics and say, hey, a family practice office that's very successful, has happy patients, is doing well financially, uses this suite of tools in this frequency. That's what our licensure model should look like, because right now we have a model that says, okay, we don't really know, so we're going to buy everything. And I think that's another opportunity to maybe decrease some of the costs associated with
There's a lot of money to
our
be
deployments.
spent there.
Yep.
Yeah. License management,
Yep.
app rationalization. Tamer, what else?
So I think a lot of what Ryan's describing, there's an actual Gartner framework that exists that he's actually talking about, whether you were talking about it intentionally or not. But for those of you that have seen this, it's one of the top trends that Gartner's put out called CTEM, which is Continuous Threat Exposure Management. For those of you that haven't seen that framework, there's a number of elements for it. Step one in CTEM would be first defining what you're going to look for. What types of things are you going to add into your visibility that you described? So it's not just assets, but it's also vulnerabilities, it's configuration management, it's my phishing tests in the who's more susceptible to clicking those links, etc. Once you've defined that business from a business level, next is what you've described, Brian, as just seeing what all the bad is. I got to just uncover the bad, open those skeletons, shine the flashlight. It gets uncomfortable because you're seeing that stuff, but now you have a complete picture of what all the bad looks like. The third step in it is that prioritization that you mentioned. So I'm going again through the CTEM methodology. When I look at all that information, I'm also looking at the way to prioritize is understanding, well, where the real risk is. Even if it's the same vulnerability with the same CVSS score and they're both on the KEV, the unexploited vulnerability, but this device is actually not exposed to the internet. It has its, we'll say, CrowdStrike agent, whichever you're using for EDR, and that's going to be a lower priority for you versus another system that is exposed to the internet. It's missing your EDR agent, as an example. That's going to have a higher prioritization. But more than that, it also takes into account your mitigating factors, right? So I'm understanding what mitigations I have in place today to help judge your prioritization, because I already have this segmented. I already have this whatever. Those lower prioritizations on that risk. And again, the CTEM, there's a few other steps to it, but I'll stop there since this isn't a CTEM conversation, but that's a big part of the data fabric that Ryan talks about, which we offer as part of this package of Zero Trust. So
to be able to look and see that kind of data, the 0-day vulnerability patches come out, and I'm always on the 2-minute drill. I always talk about patch. This new thing came out, but the reality is it's a lot of patching if you do it. And because you've got that kind of information, you can actually make some good solid decisions about what patches are the ones we really need to focus on. Yeah. And that might not be the ones that you would naturally think of.
And just to close off on the CTEM thing, there is a step in that too, which is remediating and having this extra context and workflow management between the different teams, so that your Linux team sees, here's the top 10 things you got to work on and why these are the ones you need to work on. And here's this team gets that, this team gets that. And having that workflow being a closed loop, so that when things get fixed, it automatically updates to somebody like Ryan, who's tracking this, so that he can report to the board or report to whomever he needs to report to. This is our current status of risk, or this new 0-day that's all over the news, and the board that doesn't even understand why they're asking, but like, hey, I'm hearing about this. Where do we stand with this 0-day, right? Like, it gives you an easy way to track and answer that.
I'm going to go to some of the questions from the field here. Ryan, where do you start, and what is a typical implementation life cycle, and what are the steps, and how long do they take? And you've talked about this a little bit, but I think this person is trying to get a little more specific on where did you start and what were the steps that you went through to get there? Again, knowing it's a journey too. I think that's an important part.
Right. And I will say this, I think Tamer probably has a better kind of general response to this for the steps. If you're working with Zscaler, these are the kind of sequence of events and what is the fastest path going forward. But I'll tell you, from my perspective, you just start. You have to find a place where you have a problem that you can solve with the technology. And that's where you start. In our instance, we were having performance issues with our proxy. And okay, well, that opens the door to start the journey because we had the underlying thought process that, look, we want to go down this path. We want to move to more of a zero trust orientation of the way that we do things. And so every problem that you have winds up being an opportunity to take a step in the right direction. So I don't know that there's a perfect place to start, but if you don't, then, ultimately you never get to the destination. And I think once you start getting traction and seeing success and you really do solve a problem, you have the opportunity to take on that next problem and then advance that thinking forward to the next place. So
Yeah.
Tamer, you probably have a more direct answer than that.
So the answer I have, we've seen the journey differently across different organizations based off of the business needs that they're trying to solve for, which dictates the order of operations, right? Just doing something is the best advice. Just get started, because one of the quote unquote barriers that you mentioned earlier, Drex, I only went over two. A third one is this myth that this is a 5-year thing. It's going to take us forever to do this. And that's hard for people to want to get started on something that's going to take so long. And it doesn't have to be. So Ryan's deployment only took a couple of months for an organization that size. And that's not atypical. Many of our organizations are doing this within the year, right? This is not a multi-year journey. Some of our organizations start where Ryan did, right? That's a great start to it. Other ones start where they go down the path of just take everything off the internet, right? I don't want internet exposed things anymore. Let's hide that from the internet, because that's a step one that dramatically reduces your risk as well, right? Once you've gotten started, what does a phase 2 look like? What does a phase 3 look like? And we have on our side, when we're helping our customers architect this through, we utilize what your business needs are first. So some people's phase 2 is, I want to work on the data protection side of it, right? And then they start doing data protection across internet, CASB, endpoint, et cetera, and all these different ways to do data protection. Some people's phase 2 goes into the cloud, and we're doing zero trust on workload to workload. And we're looking for misconfigurations there, because they're doing a whole bunch of cloud work right now, and it's multi-cloud. It's hard to do security across multi-cloud. So that's somebody's phase 2 as well. So where to start typically is from your business need perspective.
Right.
As Ryan mentioned, like, he had a business need, that was his starting point. But the beauty of this is once you've gotten started, it's very easy to expand into the next phases, because you're not getting more and more things. You're just flipping on more switches, right? You're just saying, okay, let's turn this on now. Let's turn this on now. Let's turn this on next, right? The hard part's done in the very initial implementation, no matter where your starting point is.
A lot of us are perfectionists. We really want to have a good plan before we start. But the problem is that sometimes on the zero trust journey can feel like I'm paralyzed. I don't know what to do because I have to have everything figured out before I start. And it just isn't the case, right, Ryan?
It's one of those things, you get into a place where you've got so much complexity, and there's that saying that's when you find yourself in a hole, stop digging. There's your opportunity. Look for a different path where you're not recreating or adding to historical decisions that you've made. And I think that's where you break out, and then you have something that allows you, like Tamer stated, it's a platform for innovation going forward. So yeah, 100% agree.
Yeah.
I think even a precursor starting point would be having the conversations across the other business units. Because if you really want to get started, we want other folks on board. And again, you may not use zero trust as your terminology, as Ryan mentioned. You may just call it, hey, we're going to modernize, we're going to transform. This is how it's going to help you, CMIO. This is how it's going to help your team's chief radiologist, whatever it may be, so that the other business units are involved in that conversation. Because if you start it without their buy-in, it's a lot harder to get their buy-in later. So I think that's a good starting point as well, is those business conversations across the board, which we cover in that CXO vision book.
So one of the questions from the field, and Ryan, I'll probably just try to wrap it up with this one. I can't believe we've been on this long already. There are so many things we could talk about. This is a great conversation. The question is very much tied to Tamer's reference there. What service lines and stakeholders have you engaged with, and which of those have become the most valuable partners in justifying and implementing a zero trust enterprise?
Yeah, I try to be really transparent about things. So I talk to everybody. I talk to our applications team, our technical folks, networking. What I find is it's our operations areas that are actually strong advocates for trying things because they're the ones who experience the pain on a day-to-day basis of how long it takes us to do X or the outages that we're creating with Y kind of thing. So I think you build advocacy for a product by solving people's problems. And that's ultimately they become the folks who help drive things forward. But for those people that you need help with in order to implement these, you have to make them part of the decision-making process. They have to be included. And everybody thinks they're a change agent until they're not involved with the decision that they get forced upon them. So I think it's a really good idea. Pull as many people as you can and make it a group effort, not have it be a CTO thing or a CISO thing. This is really a organizational effort, and we're going to try to make things better.
Yeah, I'll say that our most successful deployments in healthcare are always the ones where it's all the various teams working together in it because it is multi-beneficial. It is beneficial to the CISO's team, the CTO's team, the CMIO's team. Like everybody benefits from it. And when they're all working together on it, it makes things so great. I love those partners that are working together like that.
Everything's connected to everything else. So when you can get the right sheet music and get everybody playing the same tune, whatever the right analogy is, headed in the right direction, it can be really cool. Thanks, guys. I really appreciate it. This has been the Zero Trust Hospital Revolutionizing Healthcare Security for the Digital Age, a webinar with Ryan Winn, the CISO at AdventHealth, and Tamer Baker, the healthcare CTO at Zscaler. Thank you guys for being part of this today. It's been a lot of fun.
Yeah, thank you. I can't believe we talked for over 45 minutes and it was just a breeze. So thank you for moderating.
Yeah, of course. Thanks to everyone who joined us today. We really appreciate you. We appreciate the questions that you asked. Some of them were incredibly insightful. Don't forget, you can download Tamer's book right now. Go to thisweekhealth.com/zerotrust and then scroll down. There's a link to download the book. It's in bright red. You can't miss it. Go do that right now. And of course, thanks to our partner Zscaler, who made the whole thing happen. We're really thankful to the great relationship we have with your team. I'm Drex DeFord from This Week Health and the 229 Project. Again, thanks for being here. And it's cybersecurity, so stay a little paranoid, and we'll see you around campus. Thanks for listening to this week's keynote. If you found value, share it with a peer. It's a great way to discuss the issues and in some cases, even start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. That would be really appreciated. Thanks for listening. That's all for now.